So what happened 20 years ago was that the leaders of health and social care on both sides of the border came together, conscious that they had a common agenda in terms of the provision of health and social care to a border population, and really had the vision to see the importance of working on a partnership basis for the benefit of patients and clients on both sides of the border. And really what we've done over the last 20 years is built on that partnership working. So CAWT has been in existence for the last 20 years. It existed before the European funding, and we're confident that even if European funding doesn't follow through, that it will continue into the future as well, because it is about partnership working for a border population of over 1 million people who live on both sides of the border, who access services on both sides of the border. We had both health jurisdictions recognising that there were significant numbers of patients who were on waiting lists waiting to access vascular services. And we were fortunate in having the commitment of our consultant clinicians, vascular clinicians primarily, Mr. Gunnell, who works in the Aaron Hospital, and Mr. Mazimba, who works in Altnagalvan, who were committed to developing a solution in relation to this, working with CAWT, accessing the European funding to see if we could provide this service locally to patients. So what we have up and running now in terms of vascular services are services that are operating in the Aaron Hospital, which will transfer into the new Southwest Acute Hospital in June of this year. And also in terms of, for example, Mr. Mazimba, who is based in Altnagalvan, he is reaching into the Tyrone County Hospital in Omagh and providing services in Omagh. And we are already having tremendous responses back from patients who have accessed this service, who are clearly saying and highlighting the benefits of the services that are being provided locally.
These patients invariably were on long waiting lists south of the border, and they couldn't get done. So we had an opportunity through our vascular service here to push forward and get these patients dealt with on a more timely manner in getting assessed and ultimately having their surgery. And from speaking to patients, they have enjoyed coming here. They've enjoyed the quickness and ease of which they've had their outpatients and their surgery, and the follow-up. They've been more than happy with the service that's been provided. I think it will only improve the whole way that the hospital is perceived, especially when the new build comes online in June, with the facilities that can be offered and with the treatments that we offer from the point of view of varicose vein surgery, which would only have been possible through the input of CAWT.
Now, at the end of December, in this tranche of funding for INTERREG 4A, there'll be somewhere in the region of 14,000 patients who have benefited directly from the services provided under this European funding. Now that is tremendous, but it's almost as important in terms of just looking at the partnership working that's operating in both jurisdictions. That's the real benefit. The funding has allowed us to push the boundaries forward, has allowed us to treat many more people, but the partnership working that is in place now will be a legacy for the future, and a really important legacy.